about the pharmacovigilance trends. Now, if you look at it from a pharmacovigilance perspective, the last 10, 15 years have been very crucial in how PV as an industry has grown. What started more as paper-based cases coming in as a fax, which were then managed into a system, which were then manually looked at and then submitted, has now become a much more structured industry, where there's a lot of focus on areas like digital transformation. While I was at Novartis, we worked with a few technology companies to set up RPA. We also set up areas of artificial intelligence, machine learning. So many of the companies are right now focusing and specializing, how to really make the processes more efficient. Things which were being done in a particular X time during 5 years back are now being managed at least 20% more efficiency based on the various technologies that we are using. And if you look at it, data and analytics is playing an important role as far as the use of this pharmacovigilance knowledge is concerned. We used to work on forecasting aspects, but now those data tools are being utilized for data mining and at the same time looking at what the future trends as far as the drug is concerned. So digital transformation and data analytics are the most important trends. I'm sure you're reading about it in all the news, in all the conferences we talk about it. Will continue to be an important trend for the next few years. But what we cannot forget is that quality and compliance and process excellence are the fundamental basis of PV. No matter how much we do transformation, data analytics, it will always be important for us to have the right quality and compliance and the right systems in place, right? And over the last 10 years, the focus of health authorities on quality and compliance has increased. The number of inspections that are happening, the kind of findings that they are giving are much more stringent than what it was a few years back. I was facing an inspection in 2017, and BfArM, which is the German health authority, they gave us a comment. Our compliance was at 99%, and they said, well, as far as patient safety is concerned, and as far as Novartis is concerned, your target of compliance should be 100%, because this is not an area where you could compromise on, which essentially means that health authorities are realizing that as far as drugs are concerned, even one adverse event report can impact patient safety at large, and they want us to be 100% compliant with all the regulations as far as drug safety is concerned. So we cannot undermine the importance of quality and compliance, no matter how much we talk about transformation or data or other areas. There's a lot of focus on areas like organization culture, talent management, because again, PV talent is niche talent. It's not easy to train and develop people. So it's important to retain this kind of talent. In one of my articles a few weeks back, I've also mentioned how it's becoming important for companies to attract, develop, and retain the right talent, right? Outsourcing is another element which has been with PV for a while. We continue to outsource because it's not possible for a pharma organization to manage the volume of PV all alone. So the service providers audits are important because you're outsourcing a lot of work to service providers. Periodic audits and their preparedness for inspections are important. And then there is the element of mergers and acquisitions. With each acquisition or each merger, there's a new PV system that needs to be integrated with the existing PV system. And therefore, you need the right set of people to bring about that integration, to ensure that the new organization is compliant as far as the health authority requirements are concerned, and then ensure that they are inspection ready. So a lot of work as far as pharmacovigilance, inspection readiness, and audit is happening in the industry and will continue to happen, because as the business grows, as the companies look at having stronger pipelines, their PV organizations are going to grow. And as the PV organizations grow, the need for them to be inspected and audited is going to continue to increase. So it's a very positive and healthy trend that we are seeing in this decade.